I don't know how many people in this room market over-the-counter drug products. The saga of the sunscreen continues. It was final in 1999, but maybe not final. So we unfinaled it a little bit, and now we have new final labeling. They promise this is final. We'll see. But the big news is you have to, of course, retest everything if you use the old testing methods. And there are many additional changes, one of which involves shampoo, and of course the use of sunscreens in hair care products. There is an old ANPR that speaks to it, and I reminded some of my friends at Cedar that they really should remember the fact that use in hair products is not drug use. But continuing on, the other issue that I think involves this industry are the antibacterial products. I do not think it will be in my lifetime, but rumor has it that there will one day be a consumer monograph to cover all the products that are being now marketed under the healthcare monograph for use by healthcare professionals. According to the FDA, they were going to put out a new monograph, or a new tentative monograph on this, I think 3 years ago. Don't hold your breath. The other major activities this year brought new cooperation between the FDA and the FTC. For the first time, we saw the FDA and the FTC issuing joint warning letters. If you think the FDA is scary, the FTC is a lot scarier. They can actually issue orders that can prohibit you from making claims unless you have drug-style studies. That means 1,000 patients. So basically, all that value that you put into your product and your company can be taken away by a simple order. Another area of contention has been the FDA has recognized the USDA's definition of organic for cosmetic products. However, most recently, and I will flip down, there was litigation brought, of course, in the People's Republic of California regarding where a consumer activist group had purchased about 20 products and did their own label analysis. Based on the ingredient labeling, they decided whether or not you actually had enough of an organic content to use organic in your labeling. I think one of the manufacturers that was sued in this litigation had on the front label contains, and I don't remember which ingredient, but contains something organic. That was perceived to be a total organic claim. The Environmental Working Group analyzed the label and decided that it didn't meet standards. They don't need to see any actual formulas. They are knowledgeable enough to be able to read the ingredient declaration and decide for themselves. We'll see where that goes. The Federal Trade Commission has revised their green guides. They revised their endorsement guides. And recently, the Federal Trade Commission fined Beiersdorf $900,000 for forgetting that you're not supposed to make circumference reduction claims or cellulite claims for a cream. Expensive mistake. Not only did they get a $900,000 fine, they got a they got one of the FTC's worst form of orders. Legislatively, I think you've heard what and you'll hear more about what we're doing federally. Not only is the Environmental Working Group introduced the Safe Cosmetic Act federally, they are looking to continue their activity, which they started in California. They tried to introduce legislation in Colorado. They have now got bills pending in several states which will regulate your products, your cosmetic products. And what could happen here is just like Prop 65, where we have a Prop 65 warning for chemicals that California believes are either possibly carcinogenic or reproductive toxicants. Each state can make its own decisions as to what it perceives to be a problem and what you have to identify and warn on in your label. They can also decide what ingredients you can and can't use. So these state activities present quite a threat to the industry. You can wind up having to have 50 different labels. And it's something that we are trying to watch and inform. The other activity, speaking about California, is titanium dioxide is going to be listed as a possible carcinogen under Prop 65. Now, the way this is going to be listed, I think we can make arguments that most of our products containing titanium dioxide will not have to bear the warning. But it, again, points out, I think, how vulnerable we are as an industry to state activity and to the indictment of individual chemicals by the states. An activity that in preparing for the lecture kind of got my, raised my interest was the feds are on Facebook. The feds are looking for complaints to be filed on Facebook and are really publicizing their reporting of adverse events of all kinds. So if you don't like the product, if you've had a problem with the product, they want you to tell them about it. So and it's both the FTC and the FDA. And I have the for a laugh, you should go on and see what they're soliciting. Litigation, again, I brought up the organic litigation. There's also very interesting a class of salons that have sued a number of manufacturers of professional products for falsely labeling. They view diversion as a responsibility for the manufacturers, and the manufacturers, I think, would only wish to have the amount of control that the salons hope that the salons think they should exercise. But if the basic argument is the for salon resale only is a false and misleading statement if your product against your distribution network winds up at a non-professional retail outlet like Walgreens. We all know about the suits involving keratin products. If you go on the internet, you'll see that there are massive solicitations for salon owners to join everything. Join the class of salons suing manufacturers for false ads. Join those people who are seeking retribution against the keratin products. And we saw that in our Middle Eastern countries, Facebook made a difference. It's going to make a very large difference in this industry, and more as we move on. No longer, if you have a problem, are you going to be able to maintain it in a way that doesn't, once it's out in the public, it will be magnified very quickly. Thank you.